It's a commonly used blood test to check for prostate cancer. But today, a federal task force said the PSA test should be dropped because it can cause more harm than benefit. Cass Rusey has more on what the researchers are arguing and why not everyone agrees.
On the ice, it's all business. The guys here, most of them in their 50s, are doing their best to outskate and outwit the competition. So the last thing on their minds is their prostate. But that all changes in the doctor's office.
I go for an annual checkup, and she goes through the whole series of things that I should be aware of, especially at my age.
I've heard prostate is one of those things I should be paying attention to.
Prostate cancer is the most common cancer affecting men. 1 in 7 Canadian men will get it in their lifetime. But because it's a slow-growing cancer, the chances of survival are very good. A common way to screen for the cancer is the PSA blood test. But new guidelines by a Canadian task force are adding to a growing consensus that the test doesn't save lives. In the Canadian Medical Association Journal, a federal panel on preventive health care recommends not using the PSA test to screen for prostate cancer, even for men considered high risk.
We have to say, look, now the studies have been done, the evidence is there that it's just simply not worthwhile. It's about the balance, a very small chance of benefit against substantial harm.
In some cases, screening can lead to false positives and unnecessary treatment that can have harmful side effects like impotence and incontinence. Still, this urologist says the guidelines are flawed and are a significant setback for men's health.
By using the PSA test, we can absolutely find lethal cancers early, and by intervening in those men, we can save their lives. And therefore, these recommendations undoubtedly will lead to more prostate cancer deaths.
The new guidelines are just that, guidelines to help doctors discuss the pros and cons with their patients about getting screened. Cass Rusey, CBC News, Toronto.
Prostate cancer is the third leading cause of death from cancer in men in Canada. An estimated 23,600 men will be diagnosed with prostate cancer this year. That's 24% of all new cancer cases in men. And an estimated 4,000 men will die from prostate cancer. That's 10% of all cancer deaths in men.